We're going to start with cranial nerve 1, which is the olfactory nerve, and this is going to tell me the sense of your the smell, okay? So, for this exam, go ahead and close your eyes, and I'll go ahead and occlude one of the nostrils. Now go ahead and smell the scent and identify the scent. Coffee? Yes. Good. Now go ahead and close your eyes, and now include the other nostril. Go ahead and identify the scent now.
Vanilla?
Yes, right.
Significant findings include loss of smell or anosmia.
Now we're going to assess your cranial nerve 2, which is the optic nerve, okay? Now what I want you to do is go ahead and cover one of your eye with this. I'm going to show you a chart. Please go ahead and read the lowest line that you can read.
Filled with a hardy race of barbarians who despised life when it was separated from freedom, and though on the first.
Okay, good. Go ahead and take that off from your eye. Now go ahead and cover the other eye. Now you're going to do the same. Go ahead and read the lowest line that you can see.
Filled with a hardy race of barbarians who despised life when it was separated from freedom, and though on the first.
Good. Go ahead and take that off, and I'll take that from you.
Significant findings include visual field defects and decreased visual acuity or blindness.
Now I'm going to go ahead and assess your cranial nerve 3. This is the cranial nerve that will test the movement of your eyes, called the oculomotor. Okay, ready for this one? Look straight at me, okay? Good. Now I want you to follow my instructions, okay? You're going to go ahead and follow my finger with your eyes. Just your eyes. Ready? Okay, good.
Significant findings include dysconjugate gaze, gaze weakness or paralysis, double vision, dilated pupils with or without impaired pupillary reaction to light, and inability to open the affected eyelid.
I want you to look straight ahead at me, and I'm going to be putting the pen light, and I just want you to follow it with your eyes. Very good.
Significant findings include dysconjugate gaze, gaze weakness or paralysis, and double vision.
Okay, now I'm going to be assessing your cranial nerve 5, which is trigeminal. I'm going to be touching you with the cotton ball. I want you to close your eyes and let me know when you feel it. Okay. Forehead. Left cheek. My left jaw. Right jaw. Right cheek. Forehead. Now I want you to be closing your eyes, and I want you to move your jaw from left to right. I'm going to be assessing your temporal and masseter area. Okay, go ahead. Go ahead. Very nice. Alright, you may open your eyes. Everything feels symmetrical to me. That's good to know. Okay.
Significant findings include impaired or absent corneal reflex, facial numbness, and jaw weakness. Sensations should be symmetrical, and unilateral decrease or loss of sensation may be caused by cranial nerve 5 lesion. If the patient was hypersensitive to superficial touch from the cotton ball tested on the face, we would also use a sharp or dull end of a broken tongue blade, alternating between the sharp point and dull end. The patient would report sharp or dull with each movement. If responses are incorrect, that we would test the patient for temperature sensation.
I want you to look straight ahead at me, and I'm going to be putting the pen light, and I just want you to follow it with your eyes. Alright, sir. Now I just want you to follow my pen light.
Significant findings include dysconjugate gaze, gaze weakness or paralysis, and double vision. These cranial nerves are the most likely to be affected by increasing intracranial pressure, which causes change in response or size of pupils. Pupils may change shape to be more oval or react sluggishly. Intracranial pressure impairs movements of extraocular muscles. Accommodation is the ability of the eye to adjust vision from near to far.
Today we're going to be testing cranial nerve 7 through 9. So let's start off with cranial nerve 7. Can I just have you please smile for me? Good. And frown. Alright, and puff out your cheeks. Good. And if you could raise your eyebrows. Alright. So I'm going to put my fingers on your eyelids. Try to keep them closed while I erase. Alright, good job. Alright, so now I'm going to test your taste. If you'll just take a sip of this and tell me what you taste.
Salt.
Alright, and now this one.
Sugar.
Alright, thank you very much.
Significant findings include facial weakness, inability to close the eyelid, and impaired taste. Symmetrical facial movement and intact strength on eye closing indicate that motor branches of the facial nerve are intact.
So now we're going to be testing your cranial nerve 8, which is your acoustic nerve. Alright, so I'm just going to place the tuning fork on your head and just let me know if you can hear it equally or if you can hear it louder in one ear. Okay?
It's equal.
Okay. Okay. So next I'm going to place the tuning fork behind your ear and just tell me when you can't hear the sound anymore, okay?
Okay. Now. Now.
Okay, thank you. Okay, so I'm going to have you cover one ear and I'm going to whisper a phrase and you're going to repeat it back to me, okay?
Okay.
Alright, so cover your left ear
Talar is awesome.
and your right ear.
MedSurg is fun.
Alright, so now we're going to test your balance. So if you just want to stand up, so just stand with your feet together and your arms at your sides and look straight ahead. I'm just going to have you stand there for 20 seconds. Alright, and now we're going to do it with your eyes closed.
The nurse should observe for excessive swaying or loss of balance for 20 seconds with eyes open and 20 seconds with eyes closed. Significant findings include decreased hearing or deafness and impaired balance. Air-conducted sound should be heard twice as long as bone-conducted sound.
Alright, so now we're going to be testing cranial nerve 9, which is your glossopharyngeal cranial nerve. So if you could just please swallow for me. Okay, good job. And now I'm going to be placing these cotton swabs on the back 1/3 of your tongue. So if you could just open. Alright, and tell me what you taste.
Salt.
Okay, and this one.
Sugar.
Alright. Alright, and gag reflex is intact.
Significant findings include difficulty swallowing or dysphagia and impaired taste.
Well, what we're going to be doing today is assess your cranial nerve 10, 11, and 12. So, are you ready?
Yeah.
Okay, we're going to start with cranial nerve 10. Can you swallow for me? Okay, now I want you to open your mouth. Okay, now I'm going to depress your tongue with a tongue blade. Okay, now I want you to say ah.
Ah.
Okay, everything looks normal and symmetrical.
Significant findings include weak or absent gag reflex, difficulty swallowing, aspiration, hoarseness, and slurred speech.
Alright, now we're going to assess your spinal accessory cranial nerve, which is cranial nerve 11. Okay, now I'm going to put my hand on your cheek and I want you to press against it, okay? Go ahead, press against it. Okay, now. Okay, go ahead, press against it. Alright, now I'm going to do the same thing, but with your shoulders. Okay, go ahead, press against it. Okay, everything is symmetrical.
Significant findings include weak or absent shoulder shrug and inability to turn the head to the side. Intact muscle strength with these maneuvers reflects an intact spinal accessory nerve.
Okay, so moving forward, now I'm going to test your cranial nerve 12, which is your hypoglossal nerve. Okay, so what I want you to do is stick out your tongue for me. Okay, now I'm going to put my hand on your cheek and I want you to press against it with your tongue. Okay, now the other side. Okay, I'm going to say 3 words and I want you to repeat after me. Light, tight, and dynamite.
Light, tight, dynamite.
Okay, this is our assessment.
Significant findings include difficulty swallowing and slurred speech. This concludes our neurological assessment of the cranial nerves.